Hi everyone, welcome back to the Dr. Sia channel. In the video here today, we're going to be talking about the defense mechanism called regressive teariness. Let's get started. Alright, so what is regressive teariness and how is it a defense mechanism and how is it bad for us? Well, regressive teariness is when a person feels emotions and those emotions cause the person to be anxious because they are, for whatever reason, not allowed, prevented from, or not meant to have those feelings. They're not allowed to, for example, be angry or sad or have any closeness or any connectedness and so on and so forth. And so the person gets regressively teary. And what is that defense mechanism of getting regressively and teary? Well, it basically means that the person has no real way, no helpful way of regulating their own feelings. So they can't actually kind of go in there and go, oh, I'm sad, and what is that about? And I'm anxious about that, and so on and so forth. Instead, what they have to do is get teary so that the person who's in front of them stops. So regressive teariness is all about just kind of saying, world, stop bringing this emotion to me. For example, I might as a therapist ask a patient and say, so what is the feeling that you have there towards your mother? And the patient might get teary regressively and go, I don't know. And the whole point of that is just for me to back off, to stop asking that question. So regressive teariness is kind of in a way, instead then for me to go, oh, what happened there? Oh, I didn't mean to hurt you. I didn't mean to make you sad. And for them to go, yeah, it made me really sad when you asked that question there. Yeah, please stop asking that question. Don't ask that question anymore. So in that sense, regressive teariness is something that's utilized by children when they actually cannot regulate themselves and can't actually manage their own feelings, and their caretaker is actually not able to effectively help them regulate their feelings. So it essentially becomes, well, I'll just want you to stop hurting me. Now, what would I do for that patient who's saying, oh yeah, they start kind of getting teary? I might say, did you notice that when I asked how you feel towards your mother that you kind of got teary? And did you notice the anxiety with that? Yes, they might say, yeah, I did get anxious. Okay, and when you got anxious, you got teary. And what are the ideas about those? Like, what's the ideas that come with that? Well, it's like, I just don't want you to talk to me about this anymore. And then I might remind the patient that, hey, look, you're the one who wanted to talk about this. That's really important to notice. If we regulate the anxiety, then you won't have to go teary. I'm not trying to hurt you. We're trying to help you. So kind of a combination of different things that need to happen with addressing the teariness itself, addressing the anxiety that it causes. And then once we've kind of addressed those, pointing out that the teariness is the defense, that it's actually not sadness or anything like that. It's just a way of getting me to back off, but that getting me to back off would actually not be helpful to you as the patient. So then once the patient recognizes, they go, okay, yeah, so yeah, you're right. I do get teary to make people back off and that, yeah. And making me back off here from your feelings, would that be useful to you? Would that be helpful? No, it wouldn't be helpful. No, that would be harmful, wouldn't it? Yes, it would be harmful. Okay, so what are the feelings that you have towards your mother? And then you'll notice that the teariness kind of dries up. So that's what regressive teariness is. If you didn't know and you have a friend, you have a partner, you yourself, you have a patient who gets regressively teary, just explain to them that you're not trying to hurt them, that the regressive teariness is trying to hurt them by making people back off, not from harmful things, but from helpful things. And backing off from helpful things is actually another way of causing harm. I hope you found this video useful. I hope you like, subscribe. If you do like, that does help with the YouTube algorithm, so please do like the video. If you liked it, please do press that like button. I appreciate it. Thank you so much, and I'll see you again next time.